that string key that start பண்ணவா? Hi. So what is the topic for today? The topic for today is, let me connect my iPad. So what is the topic for today? Yesterday we had discussed about acute diarrhea. What do you mean by acute diarrhea? Acute diarrhea is diarrhea which is acute in onset and it lasts for less than 14 days. That is acute diarrhea. Most often it is infectious in origin. It can be viral or bacterial. Very rarely it can be due to parasitic infection. Okay? So the topic for today is chronic diarrhea. What do you mean by chronic diarrhea? Let me discuss. Sorry. So what do you mean by chronic diarrhea? Right. So you need to know the definition first of all for chronic diarrhea. Can you define chronic diarrhea? Keshav, can you define chronic diarrhea? When will you say chronic diarrhea? Point number one, it is insidious in onset. It is not acute. It is insidious in onset. Second, lasting for more than 14 days. And can you quantify? The answer is yes. You can quantify as 20 gram per kilogram per day. Stool quantity of more than 20 gram per kilogram per day. Stool output kilogram per day. Then you can ask me what is called persistent diarrhea. Today the topic is chronic diarrhea. Yesterday, because of computer shutdown, I could not complete persistent diarrhea. Let me write persistent diarrhea for about 2 to 3 minutes. So what is called persistent diarrhea? Persistent diarrhea is also more than 14 days. More than 14 days, but it is acute in onset. But it is acute in onset and it is often post-infectious. It is often post-infectious and it occurs as a result of carbohydrate malabsorption, because chronic diarrhea often results in loss of brush border enzymes. Brush border enzymes. What are all those brush border enzymes? Along with the loose stools, the brush border enzymes has also fallen down, leading to carbohydrate malabsorption. It can be lactase, sucrase, maltase enzymes. As a result of which you will get persistent diarrhea. What is the treatment for persistent diarrhea? Just 3 points. Diet A, Diet B and Diet C plan. What is that? Let me tell you again. First is Diet A. Diet A. Very, very important for your NEET as well as SS exam. Diet A. Second one is Diet B. Diet B. Third one is Diet C plan. Diet C plan. In case of what? Persistent diarrhea. Diet A plan means reduced lactose diet. That means you need to advise the grandmother or father to reduce the milk content to off. Diet A plan. Diet A means reduced lactose diet. Reduced lactose diet. That means of the quantity of milk that the child has been taking routinely. Diet A plan. Second one is diet B plan. What is called diet B plan? Here no milk at all, no lactose diet is called a diet B plan. Don't give any milk. In diet A plan, you need, if the diarrhea lasts for more than 2 weeks, you need to advise the mother, ma, don't give, you can give milk but reduce the quantity. If the child has been taking 200 ml per day, you can advise them to give less than 100 ml per day. No lactose. If it doesn't work, it means that you need to go for. So if it doesn't work, if it fails, if diet A fails, go for diet B plan. Diet B plan is what? No lactose diet. And finally you have diet C plan. If diet B also fails, you need to go for diet C plan. That is called monosaccharide based diet. That is called monosaccharide based diet in which you will give only chicken soup as well as egg albumin. There is no starch at all. There is no starch at all. Apart from milk, you are stopping these things. So this is called persistent diarrhea. So I am not going to discuss about persistent diarrhea beyond this. This is more than enough for your entrance examination as well as for your practice. But let me discuss about chronic diarrhea. Chronic diarrhea, otherwise known as malabsorption. Otherwise known as malabsorption. Malabsorption means insidious onset, more than 14 days duration, 20 gram per kilogram per day. More than that is the stool amount. Right. Now, chronic diarrhea. First of all, when you discuss about chronic diarrhea, you need to know whether it is small bowel diarrhea or large bowel diarrhea. Whether it arises from small bowel or large bowel. Is it possible to differentiate between a small bowel diarrhea and large bowel diarrhea? The answer is yes. Small bowel diarrhea is always large in quantity. One. As a result of which smell will be there, and it is associated with carbohydrate, fat and protein malabsorption. So carbohydrate wasted in stool, leading to lactose converted into lactic acid, which in turn is utilized by the gut bacteria and produces gas. So it often leads to explosive. It will produce Durbur sound, explosive stools. Explosive stool in chronic diarrhea means it is due to carbohydrate malabsorption. Second, and bulky stools. It is often bulky and smelly. Bulky and smelly means it is due to fat malabsorption. And finally, protein wastage. Leading to low albumin. As a result of small bowel chronic diarrhea, because of the wastage of all these things, the child will invariably land up in loss of weight. And it will land up in severe acute malnutrition. This is what? Small bowel diarrhea. Right? Whereas large bowel diarrhea is characterized by small volume stools. But these for small volume stools may be blood in stools. may be associated with tenesmus or pain, and it is associated with pain, tenesmus, and the pain is usually hypogastric in origin, gastric in origin. And remember, here there is no bulky, there is no explosive, often there is no malnutrition, less likely to have weight loss, less likely to have weight loss. So small bowel diarrhea is caused by large quantity stools and malnutrition, whereas large bowel diarrhea is characterized by small volume stools along with the blood and tenesmus. Right? This is one classification. Another thing is you need to know whether it is another type. This is with respect to where it arises. Next comes the type. Type means what? Whether it is blood, whether it is bulky, okay, or it is watery, or it is watery. Watery means it is often a small bowel. Bulky is often a small bowel, whereas bloody is used to large bowel. Large bowel. So two classification. And one more classification is you need to make the child to undergo fasting, and see with fasting improves, that is the loose stools, or remains the same, remains the same. Improves means it is nothing but osmotic diarrhea, which is often due to undigested substances in the intestinal tracts that drags water from the intestinal content. If it doesn't, if it remains the same, means it is called secretory diarrhea, otherwise called as secretory diarrhea. Right. Even though there are thousands of causes for chronic malabsorption, I am not going to discuss about all those thousand causes. I am going to discuss about only 5 causes right now. One, most common cause for chronic diarrhea less than 5 years, and most common cause for chronic diarrhea more than 5 years. Less than 5 years, it is often due to cow milk protein intolerance. Protein intolerance. Whereas more than 5 years, it is nothing but celiac disease. Celiac disease. Right? Now let us speak about cow milk protein intolerance. Okay, CMPI. Let me say this is the most common cause for chronic diarrhea less than 5 years. How I can diagnose? Remember, there are two types. Most often it is IgE mediated. This IgE mediated against cow milk protein intolerance often manifest with a rash, with wheeze. Okay, one is rash, second one is wheeze, third one is oral ulcers, and at times it can be associated with blood in stools, and also it can be due to, it can also cause blood in sputum. This blood in sputum, or otherwise known as pulmonary hemosiderosis, is called as Heiner's syndrome. Is called as Heiner's syndrome. Then the third one is T cell mediated reaction. This T cell mediated often leads to chronic colitis. Chronic colitis. Chronic colitis leading to what? Diarrhea. Again, weight loss, blood in stools, and you have plenty of aphthous ulcer in the rectal biopsy, as well as increased eosinophils in biopsy. Increased eosinophils in biopsy. Remember, so what is that? What is the treatment? So stop cow milk. Also, don't give soya. Soya also has got cross reaction. And remember, exclusive breastfeeding child can also develop, because can also develop even in the first 6 months, because mother would have taken cow milk, and this cow milk protein would have reached the child through breast milk. This is cow milk protein intolerance. Majority of them are outgrow by 5 years. What does it mean? They become normal after 5 years. Even when you give, they won't react. I repeat, even when you give cow milk, they won't react. That's why it has become less common after 5 years as a cause for chronic diarrhea. Next is celiac disease, a major disease in North Indian population, because South Indians don't eat much wheat. What is that celiac disease? Celiac disease often characterized by triad of iron deficiency anemia, 2 short stature, 3 chronic loose stools. Triad. Why is this triad? Remember, the gliadin present in wheat will cause injury to duodenum, and you all know, and causes duodenal architectural distortion. Architecture is damaged. So what will happen? Duodenum is the place where iron is absorbed. So you will get irida. What is called irida? Even when you give iron, the child microcytic hypochromic anemia will not respond. That is called iron resistant iron deficiency anemia. Why short stature? When there is malabsorption involving your small intestine, you will lose almost all nutrition, leading to short stature. And loose stools is again because due to involvement of small intestine. So then comes, how do you investigate? Again, triad. What are all the triad of investigations? Whenever you suspect celiac disease, the next thing is you need to do serology. What do you mean by serology? You need to take IgA against tissue transglutaminase. IgA antibody for tissue transglutaminase. Serology. It will be more than 10 times the normal value. Antibodies against tissue transglutaminase. Second point, you need to do intestinal biopsy. In intestinal biopsy, you will see total villus atrophy. atrophy. Third one is the trial of gluten-free diet, gluten-free diet for about 4 weeks and symptoms will resolve. So avoid wheat, avoid rye, avoid barley, avoid oat. The only good thing in celiac disease is rice, the safest one. Okay, you can't eat any chocolate, you can't eat any biscuit. Why? Because everything contains gluten. So this is the triad. So what is the treatment? Gluten free diet is the treatment. What is the new guidelines? New guidelines. The new guideline states that no need for intestinal biopsy. No need for intestinal biopsy. But instead, you need to do at least one of the two things. One, do an HLA and prove whether DQ and D8 is there or not. Why? You can't develop celiac disease in the absence of HLA, DQ or DQ2 or DQ8. So absence of DQ2 and DQ8 literally rules out celiac disease. Second, presence of anti-endomysial antibody. Anti-endomysial antibody. But in India, majority of them still rely on this intestinal biopsy because anti-endomysial antibody is not available in many places and there are no specific cutoff for IgA for trans tissue transglutaminase. So still we rely on biopsy. This is all about celiac disease, right? Then immunodeficiency. Particularly severe combined immunodeficiency, in which you can get diarrhea due to many C's. C for Candida, C for Cryptococcus neoformans, C for Cyclospora, C for Cryptosporidium, okay, and then what else? Cryptosporidium, Cyclospora, Cryptococcus, Candida. Apart from that, you can get, it can be due to isospora, you can get due to malabsorption, can again due to amoebiasis, giardiasis, what else you can have? Microsporidium. Okay, these are all the agents that can cause chronic diarrhea in immunodeficiency. And the last one is, or the penultimate one is, look at this case scenario. You get serum albumin less, so you will get anasarca, that is generalized edema, and you will get hypocalcemia and chronic diarrhea, and you lose everything in loose stools. What is this? This is called protein losing enteropathy. This is called protein losing enteropathy. And the condition is called as primary intestinal telangiectasia. And often it is leads to chylous effusions. Your chyle cannot be absorbed into the from the intestinal tract, chylous effusion. This is called protein losing enteropathy or primary intestinal lymphangiectasia. And the last one is inflammatory bowel disease. Last one is inflammatory bowel disease. It is increasingly being recognized in pediatric age group, inflammatory bowel disease. This inflammatory bowel disease can be of two types. In one type, you will have skip lesions. Tell me what is the answer. This type can involve upper GI also. This type can involve small intestine as well as large intestine. This type often involves a combination of fever plus failure to thrive plus anorexia. What I am dealing with? This is associated with aphthous ulcer. This is associated with rectal fistulas. This disease is associated with, tell me what is the disease? Is associated with strictures. And yes, and it is associated with anti-cerevisiae antibody. And what is this disease? Very, very simple. It is called as Crohn's. Crohn's. Whereas the other disease is associated with continuous lesion. It is often present with blood in stools. It will involve only your colon and many extraintestinal manifestations like pyoderma gangrenosum, arthritis, what else? Erythema nodosum, what else? Erythema nodosum, and then it is associated with P and K, antibodies P and K. And this is nothing but ulcerative colitis. Remember, in case of focal ulcerative colitis, so what are all the drugs used? Aminosalicylic acid, immunomodulators such as infliximab can be used in both these conditions. Whereas surgery can be curative in ulcerative colitis, but not in case of Crohn's disease. And finally, one more simple question that can be asked in your entrance is toddler's diarrhea. What is that? Toddler's diarrhea. So what is the toddler's diarrhea? Usually occurs in toddlers between 1 to 3 years. Often when you eat more of fruit juices, the carbohydrate in the intestine will drag water and leads to osmotic diarrhea. And remember here there are no fever, no weight loss. So what is the treatment? Less carb, less fruit juice. Okay, more of fibers. Okay, with this we are finishing our today's topic. I bet one question will be asked in NEET or next. Bye bye.